Hi, this is PT Sealam. Hi everyone, this is PT Sealam, and here's what I've created: HeartRisk Assist, calibrated, fair, privacy first cardiac risk triage app that's deployed on Streamlit platform. And here is the first page showing the project overview. Basically, this is not showing whether the patient has got disease, yes or not, but it's basically the main goal is to estimate the calibrated probability of the cardiac risk from the routine measurements of the patients. So it's for the triage, not diagnosis. So helping to decide who needs faster workup. So what I've done is the data set I have taken retrieved from the Kaggle platform, the open public data set, heart disease data set, and the link it's present on the page 8 of this app. You can find it there. And thresholds I have chosen. There are three different categories like high risk, medium risk, and low risk bands based on the predicted or the estimated calibrated risk probability. So and in production people can change based on the capacity and risk tolerance and the data they do have for this thresholds. So for the data I did see, like I have established these thresholds. 7%, as you can see on the sidebar left hand side, there's a band mapping. Probability risk calibration, like anything seven less than 7%, it's like low category. Between 7% to 35% medium category, and greater than 35% it's high category. And you can find all the information on the left hand side, and the navigation tool too. And here this is the main app, so main page of the app, Triage Diagnostics, where there's instructions on how to use. And these are the measurements of the patients. If you have values, you can input it and just simply click assess. Then you're going to get this calibrated risk and also risk band based on the thresholds that we have set. Interpretation is nothing but, like, assuming there are 100 similar patients, here 33%, so 33 would be expected to have that cardiac disease. And this is a default load high risk sample that I have placed in, so that people without the inputs can just click it, assess the risk, and it shows like 78.7%. And moving on to third page explanations, as you can see, based on like why it acted the way it is, or why it's basically showing based on the data, what kind of features, like what features exactly influence the risk of that particular patient that I have selected, particular case. And fairness, this is fourth page, it's just like slice metrics, that slice report that I have generated in the in our analysis. So here what it means, like you got, see, area under curve values here to call out. There's like two categories: age, for greater than 60 years and 45 to 60 years. So greater than 60 years, the older cohort shows lower discrimination. So these are the findings, you can go through it. And moving on to next page, model quality. As you can see, you got all the graphs here: validation curves, area under curve, uh, precision recall, reliability, and sharp interaction. So basically, what I've done is I have ran the logistic regressions, the prime as a baseline model, and also the random forest model, machine learning model, and that random forest has outperform the logistic regression. So that actually it was done with isotonic calibration, so it basically says what it means. And so that I have selected the random forest as the best ultimate model for my analysis, and ran like training, done all the analysis based on it. And here sharp is nothing but shows like what features influence the risk. And you're going to the data explorer, sixth page, you got sample data set from our analysis, and you can just click on this one of the patient id, and just select row to triage, and it inputs, automatically updates the inputs, and you can click on assess risk, and shows again the risk probability and the risk band it falls into. And moving on to the few other, there's a bad score where you can just browse the file. If you have the file with all these features instructions, then you can click on it, and it will give you the updated with the calibrated risk probability and the band it falls into, and you can download the results. And the page 8, you can see privacy and trust related to the disease, heart disease data set that we have retrieved. And the last page is the impact and recommendations. As you can see, go through it. Thank you. Please go through the app, and also we got the GitHub repository. Please go through it.